Well, hello, everybody. Welcome, everybody. And thank you for joining today's training session. Today, we will have the great pleasure of introducing or presenting you with some materials and talk about the avian flu H5N1, as well as education material for animal production workers. And so I am going to introduce myself. My name is Lisbeth, and I have been working together with my colleague Esli Reyes. And so we will be presenting the following material today. Esli, you can introduce yourself as well. Hello, good afternoon, everybody. My name is Esli Reyes, and I am the supervisor of educational materials here at NCFH. And we're very happy of being able to present today's training. Well, thank you. And so, I'm going to talk a little bit now about what we have prepared for you today in the following slides. This is more or less the agenda for today. We are going to start with a short activity in order to know how much we know about avian flu. And then we will be presenting the main material, which is the slides. And we will be talking about best practices and facilitation strategies. And we will also allow you to ask some questions in a small group discussion. And we will be presenting some health educational materials as well. And we will be talking about what the next steps are and the closure. So before we even start with the activity, I just want to recognize the work of every single one of you here and your interest in such a topic, because the work that we are all doing to protect the health of our farm workers out in the field is essential. And so these workers from all the different industries are the most vulnerable for avian flu. So thank you very much for your interest, and we will be presenting you with the most updated information. And we hope that this is helpful and you can bring this information to your communities. So we are here and we're willing to answer any question that you might have. Very well. So here we have some true or false questions. And so we're going to ask you to please write your answers in the chat box. You can then say if this is true or false, and then we can go on to the right answer. So the first question is, avian flu or H5N1 or the avian flu only affects poultry or birds. What do you think? Is this true or false? False, false. Who else? Very well. Excellent. Let's see what the right answer is. Very well, it is false, because it has been detected in birds for the very first times and it is very contagious among them. But most recently, it has also been detected in other animals such as cows and also people. So here you will be seeing at the bottom the pages in the slides that we will be sharing with you, and where you can find more information for all workers that you will be training later on with these materials. Next question. One of the symptoms of bird flu in humans is having red eyes or conjunctivitis or swollen eyes. What do you think? Is that one of those symptoms of avian flu or bird flu? Now we will be looking at the right answer. So it is true. That is one of the most common symptoms, although we still have been many other symptoms like a cold, flu symptoms, runny nose, chills, etc. So you will find more information later on about other symptoms that you can easily observe. Next question, please. And the question reads, any type of mask or bandana even is good for protecting yourself from bird flu when you are around infected or sick animals. What do you think? Is that true or false? What is it that you've heard? Next slide, very well. And this is false because CDC recommends using N95, the respirators, but also recommends using other personal protective equipment or PPE that we will be going over, such as gloves and coveralls or aprons. So you are very well informed. Thank you very much. Let's go to the next slide. And the question is, in order to avoid contracting bird flu, is it necessary to avoid consuming raw milk or foods derived from raw milk? What do you think? Is that true or false? True, false, true? Yes, it is necessary to avoid consuming any derivatives from raw milk or foods derived from raw milk. Very good. Let's go to the next slide and let's see what the answer is. Yes, it is true. And this is because it has been detected large amounts of the virus H5N1 in the cow milk, and the pasteurizing process and boiling the meat and all derived helps kill the virus. So we will be finding much more information about this on the page 23 on the slides. And I believe that the next one is the last. If a person has bird flu or flu symptoms, should get tested for avian influenza. What do you think? Do you think that is true? Let's go to the next slide. It's true. If a person is sick and has been sick and works with farm animals or has contact with someone who does this work, it is recommended that they get tested for the seasonal flu. There's a little bit of more information in this regards because it is not as simple as that. So yes, let's move on to the next slide. And thank you very much for all of your answers. And we will be presenting more information, but we know that you have already a lot of information about these topics. And this is a very good thing because this is one of the greatest qualities of all facilitators to be able to have the most updated information. Now I'm going to leave you with Leslie so that she talks to you about this material that we will be presenting today. Thank you, Lisbeth. So today we will be learning about the slides or the talk that we have with the farm workers, which is a much more informal way of educating with farm workers. And these slides are focused on the H5N1, but I'm sorry, flu with farm workers. There will be a link where you will be able to see the slides and start using it. But let me start by explaining a little bit more what is it that it contains and how it is used. And later on, we will be showing you all the different pages and actually giving you a summary of the information that you will be able to sharing with animal production workers. So let's start with the main topics and the flip chart that you will be able to speak about and the workers will learn from it. So this is basically defining what bird flu is, how is it that the animals share diseases with people. Then we will discuss about recognizing the flu symptoms in animals and people, which is very important, and how to protect from the gripe aviar or bird flu, and the importance of vaccines to protect your health and those people around you. So how do we use this resource, rotafolio in Spanish or flip chart in English? So there are different advice and tips that we want to share with all of you. We know and recognize that all of you are experts in whatever you do in getting to the people who need it the most. And so these are some of the advices that we have seen, and they're quite positive in order to bring this good experience for our farm workers. So that's why we're recommending that before you present the flip chart, you go over the entire content before the presentation to get familiarized with it and learn about it more. The flip chart includes specific key talking points in italics. We're going to see an example which you can read directly as a script, or you can study to aid your presentation. Also, it includes instructions in bold to guide you through the content. On one side of the flip chart, there will only be images, which is the side that the audience will be viewing. On the side, there will be notes for you as a facilitator with specific key talking points to be presented to the audience. Remember that here we can see an example. I hope that you're seeing it as I am. But where you have the images to the left is what the participants will be looking at, and on the right is what you as a facilitator will see. And everything that we see there in bold are instructions for you. In cursive or italics is something that you can read directly or study it and then say it in your own words. I know that many of us prefer at times to add our own personal touch to the presentation, then that is something that you can easily do. Also, the talk should last approximately 45 minutes. It could be a little bit shorter, a little bit longer, but we recommend to keep it short and concise for our workers, considering that they work many long hours and sometimes they don't have a lot of time during the day. This training also includes optional group activities and demonstrations that are completely optional, and one that needs a little bit more presentation and more preparation in advance. I'm going to be discussing that. That also has a lot to do with how much time available the group will have for you. Some of the materials I have in here with you to show them. We're going to have an activity and we will discuss it later. We will be talking about germs and viruses, and it will require that you have a small bowl to add some water. It requires that you have some pepper and soap, liquid soap. There will later be another activity which is also optional, and it has to do with the PPE equipment, and we focus on how putting it on, how to remove it. But also, if you need to do this activity, you need to get ready and prepare with the material as part of the training. And so this is the overview of the charla, or the first page, the cover. We can see the cows and we see a farm worker here. And so how does the charla or the training start, and how are we going to present it? Well, we welcome our workers. We focus on letting the participants have an introduction of what is it that they will be gaining, or what is it that they will be learning from us. You will be explaining to them that they will now understand what avian flu is, what the symptoms are that they need to be attentive at, and in them and also the animals to make sure that they are not at risk, how to protect themselves, and also what they can do if they happen to get sick. So the training at the beginning, we include a story in which the farm workers can relate to. The story is very quick. I don't want to read it because of the time that we have here, but the story focuses in two workers who were working at a milk farm, and one of them starts feeling bad. His symptoms indicate that he has a cold, like a flu-like, and he's with a coworker, and then he notices that some of the cows also seem more sick, slower, and he continues working because the man thinks that it's just a regular flu. But then the next day he feels a little bit worse. He starts seeing some swelling in the eyes, they look red, and the supervisor then recommends him to go check himself to a health center. And then he contacts a worker from, or a health promoter, or a community health worker that makes a referral to the health center. He gets tested and then it comes out positive. And then he informs the employer, and what the employer does is that he calls a veterinary to check all of the cows and all of the animals and make sure that if they are indeed sick, they can find any measures. They talk to the different workers and they buy them all the necessary PPE. And we will be discussing this a little bit later. But this story is what you tell the group at the beginning, because we will be referring to the story all throughout the charla, or the training. And so it's good to read it all together at the beginning, and then some questions happen, because we want to make sure that our participants are understanding everything, and that they are gaining knowledge about the topic. And that is how we make sure that they have this fresh in their mind, and how they will be learning more content. So remember, the part with the letters is something that you read, and then the participants. Then we start talking about what avian flu is. We explain that it's also known as H5N1, which is a type of avian flu. We talk about how normally it would affect only birds, but now we're seeing that it affects humans. And we mentioned that there are different types. Some people can say, oh, I've been hearing about this for many years. It's not something new. But what we're trying to say here is that in the present, the avian flu virus H5N1 is the one that is present in the United States, and that until very recently it started getting people and cows sick. After that, well, we're talking about a virus, and then we say, okay, so what is a virus? It's important to ask them. And then we start giving them different explanations about what a virus is, and then we say, well, viruses are tiny, they can get people sick, animals and people. It can vary, and we give them different examples of how when someone has a type of virus and they can like collide one with the other and even change the way in how it's going to affect our health, or the people or animals being infected. So we explain a little bit more about what a virus is. We also ask them what other viruses have been mentioned, and the objective is for them to understand more or less how virus work, and more specifically how avian flu works. From there, we move on to how is it that the animals and people share the same illnesses. And you can see here, well, the image, no, the picture, and you can always use your finger to highlight it further. But it basically focuses on how the animals like pigs, cows can get infected with the same diseases as humans. Viruses can be transmitted from animals to humans in different forms. It can be through direct contact, whenever you touch deceased animal or a dirty animal, or its feces or pee or any other liquids in the any other or any other parts of the body. Also, when ticks or fleas pinches, it can come with a disease. If we're talking about the milk farm workers, if we think about the machinery that they're using and the objects are contaminated and somebody touches it and then they put their hands in their mouth or eyes, they can get infected with this disease. And then the last portion is in the air. It can come in the different um, air particles when somebody's coughing or somebody sneezes, that can also get you sick. And we talk a little bit more about those people who could be at greater risk, like older people, pregnant women, and young children. And then we explain that that's the reason why it is important to take measures to protect ourselves. And in doing that, the next question speaks about how is it that we know if an animal has the avian flu? And that is very important because we are talking about when Gustavo sees that the cows were sick and actually looked sick. It was important to notice that. And so it's important also for us to explain to them. And here we focus on three types of animals where avian flu is very common in birds. Some of the symptoms that we're going to mention and discuss is that they can die all of a sudden, or they can stop eating, they can not lay eggs anymore, they're swollen on the head, eyes, legs, etc. And then we also talk about cats because that is another animal that gets infected very commonly and they can die all of a sudden. We know, of course, that they are not doing good if they die, right? But before that, they have different symptoms like they don't eat anymore, the eyes get really swollen and red, they start having seizures or convulsions and show signs of depression or lacking energy. And we also spoke here about our present problem in the United States, which is with the cows. The cows can be producing less milk or milk that has not such a normal aspect. They can be eating less and have like breathing problems. They have fluids also coming out of their noses. And then we talk about how is it that we can get the avian flu from cows. And this is a good time for us to explain that avian flu currently is changing very quickly, and it's important for us to be very attentive on what updates come up. As CFH, we're always monitoring and we will be conducting cases, but it's important for us, for you to do it as well. So this is when we connect with the history of how Gustavo got sick as a result of a cow being infected. And so we talk also about how we don't know exactly all the different ways in which the avian flu can be transmitted from cows to the human. But something that was presented in the activity at the beginning was that cows can release great amounts of the virus in their milk because of the nature of the workers in the milk farms. They can get this can come into their ears, nose, mouth, and into their body through saliva or nasal discharge. And just as we learned, well, this can also happen indirectly. The cows can infect the area the where the cows are and all the different objects that the workers can touch. And so after that, we move on to the different symptoms of the avian flu in people. You can see the image here, and we wanted to highlight and also put in black or in bold that one of the biggest symptom is the red and swollen eyes because it is one of the most common symptoms. The fever, chills, body pain, a bleeding nose, or nausea, vomiting, and seizures. We know that some of these symptoms are very, very similar to those of a regular flu, and that's why, and we can say this again, that is one of the reasons why Gustavo thought that this was only a cold, a regular cold. But then what happens is that when you have a cold and you're working with other workers, it is necessary to take that extra step to take care of yourself. And so we got to the first activity, which is optional. And we talk a little bit about how to protect ourselves from the avian flu. We know that one of the main ways is by using proper hygiene and washing our hands. And so we have this activity and it's very easy. I already explained it a little bit, but I told you what the materials that about the materials that we needed. We needed some pepper, water, soap. And so the employers put their finger in, and when they remove it, they know that they have tiny pieces of pepper that can resemble the virus. Then we grab a little bit of soap, they put the hand in it. What's gonna happen is that the pepper is gonna separate from the soap. That is one way of explaining how important keeping proper hygiene of our hands is, especially when we're trying to protect ourselves from a virus. And an interactive activity as such is probably important to do with things that we might have even in our home or our office. And this can help the employer remember to wash their hands and that the information really gets to them. And afterwards, we are going to talk about the personal protection equipment, and I'm going to ask Lisbeth to help me with this summary of the training. Well, thank you, Leslie. And it's very important to know all of this information being presented and this last activity as well, because it is very visual and it can help the people to understand how effective washing the hands can get to be, which is a habit. But unfortunately, we know that many times people don't have the resources, and that is the reality. And so I just want to emphasize that there are some links here in the chat in case you have not seen them so that you can have access to the flip chart. This is available both in English and Spanish. You can download it and see it from there. We also have a question that asks, who is it that is responsible for buying the PPE equipment or personal protection equipment? We know that the employer should be the one providing this to the employers. To the employees. We know that at times this is not possible, but it is exactly how things should go. If it's not like that, well, I believe that we can provide some resources so that mm, the PPE can be obtained at local level in order for the workers to protect themselves. So I see a comment from Hunter, I guess. Yes, I believe that it is important to mention that if the worker is lucky enough and has a responsible worker, the material will be provided, but that is not the reality. The truth is that we are at the milk farms, the workers don't have materials, don't have resources, and the thing is that the first thing to identify the cow is also when the cow has the swollen eyes. When the worker has the swollen eyes, it's because he's already contaminated or infected. the owner of the farm should provide him with all the resources, but that's not what we see. In this area where we're working, only one of the employers has provided help and resources. Everybody else don't know even how to get medicine or who to ask for help. They have no support from the farm owners, and they're doing basically whatever they can on their own. But they are very concerned about how the animals are getting sick, and the employees are responsible or feel responsible if the cow dies. So what we're looking at is that they're really concerned about the animals moving and not more dying, I'm sorry, and not the worker. Yes, unfortunately, we know that this is the reality, and that is why we are doing this type of trainings. And it is important to share this information, just like Leslie was telling us. And that's the reason why we need to educate them so that they can know what to do in case an animal is sick nearby, and don't wait for the animal to be sick. But there are some resources, and in some health departments, and there are different resources depending on where you're at. But if you have any questions, yes, we are available to connect you. And in case you know of any farm of a specific situation and what's going on, let us know so that we can connect you with resources. Right now, we are not providing any PPE. Thank you for asking the question in the chat. We are not providing this directly or buying it directly, but we are connecting with other agencies or other clinics that may be able to be providing these resources. We have a question here from Alfredo. Yes, thank you very much. I work with the health network in the Valley of the Center of California, and one of the questions that I had was that there is a day specifically where we could be printing this material and information in order to share it with the members of the community, or a day when it could be available so that we can share it. Yes, we are adding the links in the chat. You can have access to this. They should be available in our webpage. And this is the official launch, so to speak. Because yes, it has taken some process for us to go over this information that is constantly changing, and there is information that is also changing based on the recommendations that we get from CDC and else. But it is already available, and you will be receiving the links as well later on after the training. But you can have access to these and print them out whenever you want. When you download the resources, it will ask you about the size and the format, which is 11 by 17, I believe. Yes, 11, 17 inches. And so that is the size of the materials so that you have it printed, and you can see all the images for the worker and what the facilitator is going to be reading from. And let me just say, we will continue with the topic, and then later on, in the end, I will allow you to have a discussion with the workers, which is essential to speak about these topics that we have identified in the lack of access to resources. Because yes, it's good to discuss the information, but how can we look at the resources so that the employers can protect themselves? And so in this portion, Ellie was telling us it is the activity on how to protect ourselves with the hand washing. And this is an optional activity. If you have PPE equipment that you can use to do a demonstration on how to appropriately wear this equipment is very important, because the problem is that sometimes the equipment is there, but they don't use it as you should. So who can have access to the personal protection equipments? And so it's very important for you to review this with the different workers and go one by one and to see how it is that you put it on. Here you go over the materials. You need an overall or the waterproof apron, respirators, boots, hair cover, face protectors, mask, and gloves. And you can ask a volunteer so that they can help you with every single step. And also to review how to use it properly. And so that you also know that we can connect you in case you don't know where to go, so that you can obtain these material. And this is for all types of people, because some people work directly with milking the cows. And there might be different roles, but those people who have a greater contact with the droplets of milk, we recommend that they use the safety goggles and head covers, and that the gloves don't have any holes, and keep your hands dry. Very well. Next slide. And then we go on to how to remove and how to clean our personal protection equipment. Sometimes we don't think about how careful we need to be in removing our equipment, but it's essential, because sometimes we've been in a very highly contaminated space, and if the germs are there, they can remain on our personal protection equipment. So you can here go to make a reference about the exercise of the water and soap, and remind them that whenever they go from the bathroom to the rest area or the farm, they need to remove properly all of the equipment and materials which is disposable and in a right manner, and also clean it after every single use. And how they can clean with water their boots, their apron, remove their overalls, remove their gloves, wash their hands, or use antibacterial with alcohol to remove their face protection. Remove the face cover or head cover, the safety goggles, the mask for the respirator, and then wash your hands again. So it's important to disinfect everything. If you have the opportunity to take a bath, or whenever you get home. And so then you can leave everything at work. If there is any material, then you can leave it there. And so that it's available there for you to use next time. And there's a very interesting question here. And so there's a question here about how long germs last on the PPE equipment. And so in the past, it has been proven that they last for 26 hours in plastic and 4 to 5 hours on human skin. Thank you very much. That's a very good question. Next slide. And so here we have this information about, we also need to let them know that we need to avoid having the raw milk or handcrafted cheese, because when milk hasn't been pasteurized, or when it goes through the process of boiling until the germs die, It's very important. So if people consume or eat this kind of product, there are still large amounts of virus concentrated in the milk or the cheese from the cows. So we recommend to consume only pasteurized products. Next slide. And well, this section speaks about vaccines. Right now, as you might be aware, we have no vaccines for this virus specifically, but we are promoting the vaccine for the seasonal flu. So what we're doing here is provide information about how is it that vaccines are important. And this is important because we have just been through COVID and there are still many people who are resisting vaccines in general, but it's important to remind them why is it that they're important. And so here we give them an example. Imagine that you are about to start a horse race. Both horses are healthy, but one of them has a horse that knows the track and has been through the track in the past, but then another horse that's never gone through that track. So who has the greater possibilities of winning the race? And so this is only a small comparison example for them to understand how is it that a vaccine can work in our bodies and how we can fight a disease. So what happens if a person has a health condition and gets infected the with this virus, the avian flu virus? Well, it all depends on what health conditions the person previously has. Because right now we have several cases, and maybe every single condition that you might have might affect you, and then you would need additional medicines and have even worse effects on a person that is much healthier. And currently, because we just saw this case about this person that I believe went to the hospital, and I believe that this person recovered rather quickly. I don't have much information, but yes, I believe that it all depends on the prior health conditions. If someone has the seasonal flu, what effects can they also have? Well, thank you, Andrea, for the question. Next slide, please. And so this is the next slide. And after we talk about why vaccines are important, this is the recommendation about why it is necessary to get your vaccine for the seasonal flu. And we know that even though this is not going to protect anybody from getting sick with the avian flu, we do know that in the end we're speaking about a type of flu, and it can help someone if they have some other condition, can help them protect their body and allow the body to respond better and not get so sick or end up in the hospital. Because we know if there is an emergency and you need to end in the hospital, that means that these people will have a high cost in terms of health, especially for those who don't have any access to health services. And let's speak about the avian flu. So this has to do with the test, and this is information that we will be updating rather quickly because right now they've been saying that everybody who has flu symptoms And the recommendation is to take the test, especially for those who have contacts with animals that are sick. But there's also this great possibility that many people might not have symptoms or are asymptomatic. And I believe the information here is not included for asymptomatic people. But if you're working with someone who you actually know is sick, most likely this person will need to get a test. And we will let you know if there are any updates in this matter. But it is important to look for the test and make sure that nobody else in the family or other people get sick. Next slide, please. Key takeaways and discussions. So this last activity, and I know that there's a lot of content so far, but already when you're doing this facilitation, keep in mind that the time will run faster. What we do recommend is that you have this conversation, very similar to what we're doing right now, and talk about the challenges of implementing this. If we're talking about using equipment and washing your hands, if there is no water, that you can have this conversation because you can help the workers and so that they listen to you and you listen to them and see what difficulties they have and we can support them. This is an activity that we placed here at the end to try to identify what the barriers are. How can you use this information? What is it that you can implement for work and to accomplish changes? Because some people are not very open to changes, it might get hard, but you are at times the only resource and who can transmit this information for them. So let's see, there is one question over here. The flu test for animals? I don't have a lot of information about animals yet because I believe that I don't know if this should go through another department or should we need to speak to a veterinary in the area? We are more concerned about the farm workers' health rather than the animals, but maybe we can talk to a vet and have more information. In the farms, I know that they usually call a veterinary and try to find the tests. I don't know if they are easily accessible. But if there is a virus going around in the farm, you do have to test the animals. And I believe that that has a lot to do with wherever you are, what your location is. May I add something? Yes, what we have been told from the milk farms is that they are responsible of identifying the cows when they're getting sick. The first symptom is that their eyes gets sunken. And whenever there are two or three cows like that, they need to call the veterinarian. The veterinarian runs tests, and then he Well, thank you very much for adding your experience because yes, it all has to do with how they work in every single location, but it's important to know what your experience has been. So thank you for sharing with us. And then we also have the last one here, and it's part of the information where we're getting information about the resources that you can have access to. We also have the free hotline number, a voice for health, if anybody has any questions on how to have access to personal protection equipment or when to have the contact of a local clinic. There's a team that can provide you with more information and also with much more materials, which we will be sharing with you. And once again, this is available in English and in Spanish, and there are some materials here for support, and there's key information for the participants that we can share with you in the next few minutes. Next slide, please. I have a question. Is there any type of follow-up or what happens after the people that have been sick with avian flu? And what are the secondary effects or side effects in the short, medium, and long term? That is a very interesting question because so far what we know is whenever there's a positive case detected, they do get antivirals, but we really don't know what type of follow-up or side effects or sequels have been because these are very special tests, and after there's a positive case, the we haven't received a lot of information about what the follow-up has been, or even if there are any other recommendations, if they have to be isolated. And little by little, we will be learning more about this portion. So far, we don't have a lot of information on that, but it's a very important topic because, yes, it is necessary for us to know if there are any sequels, but so far we don't know. Thank you for the question, though. Any other comments before we move on to the next stage? I would just like to let you know that unfortunately, in the milk farm, not necessarily they have precautions that after every single use, they can disinfect and they can wash their equipment because of the lack of time. So how effective are we in saying how much time a person needs to take in disinfecting the equipment before they use it all over again? Yes, and that has a lot to do with how much equipment they can use because you can see that the list is very long. And it all depends on the resources, if they have water and soap, how much time it takes, or if they're going to use the antibacterial gel, how long that can take it, at what place they're going to do it. Because I would invite you to do a practice or a demonstration during this training so that you can see how much time this takes you in reality. Because it is actually recommend that if there is no time at the end of the work shift, well, that at least they can dispose whatever needs to be disposed. If there are any gloves that are torn, they need to dispose them because the thing is that sometimes we've heard from them that they don't have any gloves and they keep using the same ones, but that is not protecting them anymore. So they need to dispose whatever they need to dispose, and they also need to identify the different materials because some can be disposable, some is not. And depending on where the milk farm is, they need to do a practice. I invite you to do this practice in order to know how long this can take you. We have another question here. What's the best place in order to obtain an H5N1 test? The health department, community health, or drugstore? The community clinic is probably the best because the health department, I mean, we don't know if the worker directly can get sent there, but a clinic can make the referral. It all depends on what the contact and the level is. I believe Bethany has a question here, or I'm sorry, a comment. I'm sorry, it's just that this is a very good question, and the best thing to do is to obtain a question from the health department. But we know that it is difficult at times to engage in contact with the right person. With the clinic, it's a little bit of a struggle because what they will be doing with the clinic is that they will give you the flu test, and if it comes out positive, then another worker has to tell them that I work with animals. I believe that they're infected. I am concerned for having H5N1. And if it is positive with the first test, the doctor or the nurse has to request yet another test from a new lab. So it would be much more direct if you can engage in contact with the health departments. Well, thank you very much. And yes, I believe that with the health department right now, I mean, I don't think this has a cost for them because this is a much more specific test that they need. Anna, do you have a question? It's not a question, but a comment. Because we had already shared this information in a previous talk, but the public health department in Colorado already made announcements that they will, or that they have the capacity of providing avian flu tests free of charge. The only thing is that they were not able to provide an answer as to what were the places in all the different areas, like in Greeley or Fort Collins, where they are going to have the test available. That response wasn't given to me, but they do have already the availability to provide tests for avian flu, and they are free. But they didn't know exactly where, and I said, okay, well, if you have them, and there are workers that want to go get tested, where is it that we need to go? And they said, well, I'm going to send you information, but they haven't sent it yet. Yes, if it is in Colorado, I believe that there's a pilot project that they're running with several drugstores. Maybe we can request this information from them. Because yes, it's not something that is happening everywhere, but it's something that is going to expand the services and the tests. Thank you for your comment. And so we have other activities. So I'm going to go faster now with this other slide. And then we will have a discussion in smaller groups. But just for you to consider, whenever you are facilitating this training for your workers, we need to be familiarized with the topic, with the content, and open a safe and respectful space because we know that the working conditions are hard and the reality that they face might be difficult for them to for them to implement everything that you are teaching them, trying to keep them animated and ask questions, and that there's that this is a safe space for them to ask questions because you're just bringing them information. And it is important to be very sensitive. You will notice that there are a lot of workers that have been in places where they have had to kill a certain number of animals because they've been sick or work conditions that may be traumatic for them because they have been through many difficulties, and you have to be aware of this to be able to listen to them and recognize the experiences. Be honest, don't make up any information. Many times they ask us difficult questions. Here, you're putting me to the test. But it's important to be able to say, I don't know. I'm going to find out information later and I will share it with you. It's important and also to keep updated on the latest news. We're going to move on to the next slide. And we're going to do a small activity in order to do this. We will be taking 10 minutes and we will split in groups so that you can all share what are the challenges that you anticipate in implementing this charla or training. What are some ideas that you have for addressing these challenges and additional comments that you might have? And again, if we don't have the question, if we don't have an answer to your question, yes, we can share this later on with you as information is constantly changing. There will be one group for English speakers only, and they will stay here with the main group. And then everybody else who speaks Spanish are going to be joining the other groups. So Vanessa, thank you for helping with this. Us are back. Very well. I believe that we all had time in order to discuss this. And now we want to hear from the different groups. So I don't know if anybody can share with me what are some of the challenges that you anticipate that may happen when implementing this charla or this training. You can talk about the logistics of getting the workers together or topics that maybe is rather sensitive. If somebody wants to share, you can just raise your hand or open your microphones and to discuss the different barriers. Oh, yes, my name is Rosa. My internet was not doing very well a few minutes ago. I'm sorry. But one of the barriers that you can find along the way is the workers have different shifts or broken schedules. And so it's difficult to get them all together all at once and give them one only meeting and provide them all the necessary information. So that is one of the barriers. The other one was also that was also mentioned is that the employers don't give us the time or the availability. The bosses, some of them are skeptical. Some are skeptical and they have told us that they don't care about the information because they believe that the disease is no longer there. that they really don't want to believe that that there are still outbreaks of the avian flu. So those are the challenges that we have faced when we've gone to provide these trainings about avian flu. Some bosses or employer do up to work with us and talk to us and share information that they've heard from others, but they say that this is gone. It's no longer there. And for the vaccines, one of them even asked, "Are there vaccines for that?" And we said, "Well, we're sharing this information, and if you have any workers, well, you can all talk to each other and get together if you're interested in receiving the vaccine." So some of them have said, "No, we're not interested." So those are the challenges that we face, and that's one of the challenges, that these are the responses that some of the employers provide to their own employees or workers. Yes, thank you very much. And this is actually something that we discussed as a group. We have to, since we know what the barriers are for our populations, we need to find different strategies. We spoke about looking for other organizations around us, churches, even schools, parks, where we can also share this information. And due to time constraints, I believe that in the end we can have a little bit more time for questions, but I don't want our time to run out without us being able to share the educational materials that we have for educating on avian flu, and specifically the materials that go with this charla. One of the reasons that we've been sharing this material is that the workers come to us, they learn about the charla, but they don't leave empty-handed. They can take some material with them and keep this information with them. We will be sharing some links to the chat, and this is a talk in English and Spanish. You can put the link here with the QR code, and it will take you to the information that we have been sharing. The next one is this one, and it is a booklet that folds in half, and this is for the workers. This booklet, you can find it in either English or Spanish, and it's a summary of everything that you have taught during the training. We recommend, and it's a good resource or tool, that whenever you're doing the last page where you are discussing um, what they have learned, you can use those resources because it refers to everything that you discuss, which is very important. Something big for this is that you can personalize this with your information, health worker or promoter, and there's your information. And if there are any questions, there's where that you can go, or you can offer your information in case they have questions. We also provide the information of the resources for our farm workers, which is a voice for our health, and there's a QR code there where if they can call if they want to connect to a health center, a store, a drugstore, and else. This link is also going to be available for you if you want to download the Charla and then print once you're ready to implement it. And the next one, and before we finish, besides this, NCFH has been working in different products for avian flu in general that can go very well with additional charlas. It is important to mention that these resources that I'm going to show you next are in different languages for even indigenous populations. We always focus that this is under the right appropriate language, that we respect the and integrate cultural values, and with the help of visual aids. And here is some example of our most recent resources. Here it explains a little bit further what avian flu is. And you can see pictures, and it is both in English and Spanish, Mam, Kish, Mixteco, Nahuatl, Africans, and Canchobal. And if you go to the NCFH page for infectious diseases on our page, you can find all of this information. You can download it. And all of these indigenous languages are not only printed out, but also in audio. They can hear everything through the audio. We also have public service and announcements or stories that are audible, which they can use to learn from a story in all those different languages. And we also have social media graphics that they can even share through WhatsApp or other type of messages. These are brief messages, and it sends the image and what message can goes there with them. You can find all of these resources in our infectious disease page. If there are any questions, we will be sharing the links with you later after this presentation, and then I'm going to leave you with Lisbeth for closure. Well, thank you very much, Leslie, and I just want to recognize that we've run out of time, but if there are any other questions that you might want to share with us, we can stay here for the next few minutes to answer any questions, or we can share our contact information in the chat so that you can communicate with us, and very gladly we can answer any of the questions that you might still have. I would like to thank everybody for your attention, and we're very happy um, that we can provide you with updated information. So this is the end of our presentation, and thank you very much for your attention.